Good morning, everybody. I'd like to welcome you to our Saturday morning plenary, the Year of the Nurse, Leadership, Advocacy, and Activism in Action. My name is Jonah Pierce. I'm a Director at Large on the Board of Directors of ANAC. And I am thrilled to be able to introduce our plenary speaker, Dr. Ernest J. Grant. We have been colleagues at UNC Healthcare for many years, so this is very exciting. Dr. Ernest J. Grant is the 36th president of the American Nurses Association, the nation's largest nursing organization that represents the interest of the nation's 4.2 million registered nurses. He is the first man to be elected to the office of president of the American Nurses Association. He is a distinguished leader. Dr. Grant has more than 30 years of nursing experience and is internationally recognized burn care fire safety expert and serves as adjunct faculty at the UNC Chapel Hill School of Nursing. His clinical leadership experience is extensive and his full bio is on the conference app. It is my pleasure to welcome Dr. Ernest Grant to our conference.
Oh, come on, it's 9:30. You guys definitely need to be awake. Let's try it one more time. Good morning. Good morning. Okay, I think you are awake out there. This was quite an honor to have Jonah introduce me. As he mentioned, I worked at UNC for 36 and a half years. And I was telling someone else that when you work at an institution that large for that length of time, you get to know a lot of people in a lot of places. And Jonah and I would meet every morning at Starbucks at our hospital at 8 o'clock. And I was just telling Melanie that the folks there knew at 8 o'clock in the morning, have a venti pike waiting for Dr. Grant. So thank you very much. I felt very, very honored. I want to thank you also for not only for all the hard work that you've done in the last 19 months, but for the work that you do every day, day in and day out. As we know, a nurse's work is never done, and even though we all have our different specialties and et cetera, we still strive on, and we are that engine that keep healthcare going. And so thanks for all that you do. So the title of my talk this morning is The Year of the Nurse, Leadership, Advocacy, and Activism in Action. And what I plan to talk to you about is a little bit about essentially what we've been doing at ANA over the last year, year and a half, on a lot of different focal points, particularly obviously addressing COVID, but then also some of the social activism that we have launched into as well. And I hope that will come through fruition in May of next year, and we'll continue. But so if you bear with me, though, the first couple of slides, I need to talk about the organization. So you may have heard the term ANA Enterprise. The enterprise is composed of the American Nurses Association, the American Nurses Foundation, and the American Nurses Credentialing Center. These three organizations work together as one cohesive system, if you will, to achieve the enterprise vision, which, as you see, is a healthy world through the power of nursing. So each of these organizations use their strategic plan, and we work together to make sure that that mission is fulfilled. Meeting the needs of nurses, no matter in what area of specialty practice you may have, but from the beginning of your career all the way through the end of a nursing career, if there is such a thing. To me, once a nurse, always a nurse. But either way, the three organizations work together to achieve that. And as Jonah mentioned, yes, we do represent the interests of the nation's 4.3 million registered nurses, and we're at the forefront of improving the quality of care for all. Our core functions is through advocacy and professional development, and we can't do that alone. Obviously, we do that through the strength of our membership. I am proud to say that over the past few years, our membership growth has put us in the top 9% of associations for membership growth. In fact, according to a national benchmarking survey, ANA is the #1 fastest growing association among individual organizations over the past 5 years. And we've continued to experience phenomenal growth during the past few months, particularly associated with COVID. So thank you. But we can't do that alone. We do that with our mutual partners, such as with ANAC and our 50 constituent and state nurses associations as well, and 39 organizational affiliates that work with us as well. And as we know, nurses, we're the largest healthcare profession. We spend the most time with patients. And I'm proud to say that for the 19th consecutive year in a row, we have been ranked as the most trusted profession. Hopefully next month, Gallup does that poll, the annual poll of the most trusted professions, and I don't see any reason why we can't make it 20 in a row. So let's hope. Hopefully in January I'll get have the pleasure to announce that. But we know though that we do that because obviously spending the most time with patients, you get to know them and you become very trusted. We see people at a very vulnerable time in their lives, and it takes a lot for someone to open up and share what is going on with them. And I, as a nurse, am proud that I am able to be there when, for that person during that crisis in their life, but then also help them through that and then get them to go on, to continue on. A couple other milestones. ANA is celebrating its 125th anniversary this year. As Jonah mentioned when he was doing my introduction, I am the first male to be elected president of ANA. Thank you. At that point, it only took him 122 years. So let's hope that it doesn't take another 122 for that to be repeated. And that those of you who may be certified through ANCC, milestone is that they're celebrating their 30th year. And actually, I just flew in last night from our Magnet conference, actually Magnet in Pathways conference that was in Atlanta. We had a little over 8,000 in attendance and another 6,000 that were online. If you've ever been to the Magnet conference, you know that those numbers were down. Normally, it is the largest gathering of nurses in the country, and normally we have about 20,000 to attend. So hopefully next year, those numbers will be back up. But over the years, though, we have had the privilege of serving nurses through either through ANA or through ANCC, and we'll continue to do that. So the year of the nurse. Well, we had planned in 2020 that was going to be a major milestone year. The World Health Organization was finally going to give nursing its due and recognize us for all the contributions that we make. And one of the reasons for that was that it was to celebrate the 200th anniversary of the birth of Florence Nightingale. I was there when that happened. And then a little thing called COVID decided to come along and interrupt the plans. But it even put nursing even more on the spotlight. I think people around the globe got to really understand who we are as a profession and the work that we do, no matter what, either in acute care, long-term care, community health, and you name it, even education, school nurses. And then the World Health Organization decided that in 2021 we would continue to celebrate the Year of the Nurse because we did not get our just dues. And so we joined in celebrating this milestone year as well. And our emphasis was on promoting nurses' health and well-being, to recognize the role that nurses play in meeting the needs of patients, and of course, honoring you and your contributions in every way that we can. Despite the difficulties that we're facing, we still encourage you to continue to celebrate the Year of the Nurse and make it your year, even though there's only about 6 weeks left in this year. But I will say that we're planning, moving forward as well, and planning for 2022. We will have the Year of the Nurse as well. But this year, I just want to highlight some of the things that we did during National Nurses Month. And notice that I said month and not week. In 2020, we started the first annual National Nurses Month. We decided that we deserve a celebration for a whole month and not just a week. So we have expanded that, and every day, as we know, nurses excel, they lead, and they innovate within our communities, our clinics, our hospitals, and healthcare systems. So we are honoring them in many, many ways. In May of this year, one of the things that we did do was, as I said, mentioned, it was the second year of a whole month of celebration, still celebrating National Nurses Week. But the other weeks are also spent celebrating various things also. Well, when COVID came around in 2020, we literally had to turn on a dime. I remember that we closed the office on Friday, and Monday morning, everybody was operating from their home. And one of the things that we were able to do was to be able to listen and serve as a resource for nurses and what they were needing, no matter the particular setting that they were in. And we still have the COVID-19 Resource Center. And I would encourage you to go online to nursingworld.org and look at what is there, because it includes a lot of pertinent information, some of the latest information for both nurses and the consumer. There's frequently asked questions, there's nurses' stories, and we would encourage you to share your story. We want to know how COVID affected you. Lots of educational offerings, our advocacy efforts, including the latest vaccine resources as well. And if you know of a nurse who is one of our fallen nurse heroes, please go through and make sure that their name is listed there, because we want to honor those individuals who paid the ultimate sacrifice as well. Another thing that our American Nurses Foundation began to do at the beginning of the COVID, and has continued even to the present day, was to begin to collect data from nurses about their experiences on the front line. And that has been a priority and continues to be. So the Pulse on the Nation's Nurses has been quite a series of surveys that we have done. We've conducted 7 in 2020. All the data that was gathered for that was used to help inform some decisions about how best to meet the needs of nurses during and after this public health crisis. In March of this year, we just recently finished a survey, and one of the things, compared that to March of 2020, this is the beginning of the first sign that nurses were suffering from a lot of mental health fatigue and also some behavioral health issues as well. And we compared the March of last year to March of this year, and as you can imagine, it obviously was showing that there was an increase in that. In September, our last survey, just completed, of 22,000 nurses nationwide, continued to show that nurses are still suffering severe mental health crises, and also the conflict of vaccines, the financial status of nurses as well. And believe it or not, even though we're not hearing about it in the news, there's still some PPE situations that are out there as well. Some of the other data from our latest survey, which is very disheartening, and we'll talk a little bit more about the nursing shortage in just a moment, but one of the survey questions asked nurses, do you plan to leave your job within the next 3 months? 29% of the respondents said that they would. Another 36% of those respondents stated that they were thinking about that. That's pretty serious. That's, and that is something that we definitely need to address. And as I said, we'll talk about that in just a couple of moments when we talk about the nursing shortage. Other things that we did during COVID was begin to focus, once we got the vaccines approved, was to begin focus on getting not only nurses but the public, educated and vaccinated, so that we can hopefully see an end to this crisis. We know that nurses are instrumental in educating Americans about the vaccines, and also have been very instrumental in ensuring that the vaccines have been administered in record time. So just a few things that we did. We joined the Ad Council and the COVID Collaborative to launch the COVID-19 Vaccine Education Initiative. And the name of that's called It's Up to You. And I was a part of a media tour with experts from other healthcare organizations to educate Americans about vaccines. We also partnered with the CDC with Project Frontline. This is an initiative preparing frontline healthcare providers to protect themselves, their patients, their communities from infectious disease threats, including COVID-19. And then I also participated in a program called Count Me In, which was sponsored by the COVID-19 Vaccine Education and Equity Project, which provided education about vaccine outreach specifically to communities of color, which, as you know, was being struck disproportionately as a result of the vaccines as well. One of the other initiatives that we have focused on or just launched is it's what we call Flu Shot Fridays. We have partnered with Santa Fe Pasteur to encourage Americans to get their flu shots. You know, last year I think there was only a total of around 200 diagnosed flu cases, and if you stop and think, everybody was home, everybody was sanitizing their hands or wearing a mask, and it was a perfect situation. But now we are anticipating that we may have what we call a twin-demic that is coming aboard. So with Santa Fe Pasteur and actress Jennifer Grey, and you may or may not know her, but she played Ferris Bueller's sister in Ferris Bueller's Day Off. And so we are calling it Flu Shot Fridays because it was a Friday that Ferris did not want to go to school. But the whole idea is that we have kicked off this campaign about 2 months ago, again, encouraging Americans to get the flu shot as well as the COVID vaccine also, so that we do not have a twindemic. And in fact, I'm spending most of the day on Monday, again, doing a social media tour with radio and TV stations around the country, encouraging that individuals do get their flu vaccines. Another thing that the foundation has been doing, we know that once this crisis is over, this pandemic is over, healthcare is not going to look the same. We don't know quite yet what it's going to look like, but this is a perfect opportunity. Our foundation has put out our RFAs for reimagining nursing. What are some of the ways that we can improve the way nurses are educated, or how do we get more nurses, ready to provide care? So we are not quite sure about how this will turn out. We had 347 applications, and we have $19 million that we are putting towards this Reimagining Nursing initiative. Thankful to Kaiser Permanente for supplying the first $14 million, but the initiative is going to focus on 3 goals. One, an adapt diverse workforce. The second one is a digitally enabled nursing practice and a nursing-led person-centric care delivery system as well. So the deadline for the RFAs has ended at the end of October. We hope to select about 11 projects that we will focus on and give them up to $1.5 million to run some pilot projects, and hopefully we will see what will come out of that. But one of the huge things is, of course, practice-ready graduates. Being so that when schools of nursing do turn out nurses or graduates, they're ready to hit the ground, if you will, so to speak. And so we'll see how that will turn out. And now to talk about what has really kept me busy over the last year, besides COVID, is our workplace or our a little bit of advocacy and leadership. ANA has a very rich history of advocacy for over the last 120 plus years, from women's suffrage to standards for education and practice, to supporting legislation for Medicare, to practicing economic and general welfare, to shepherding the code of ethics with interpretive statements, to codifying our social policy statements, to creating a nurse credentialing agenda for the nation. ANA has been serving nurses, the public, and the profession. Looking at the slide in front of you, on your left is Jo Eleanor Elliott. She was then president of ANA back in the 60s with President Lyndon Johnson at the signing of the Public Health Service Act. The significance about this particular act is 2 things. One, it obviously reinvigorated the public health service, but it also included Title VIII legislation, which is for nursing education, and that has been renewed every year, and I'm proud and happy to say that that was renewed again this year. That would allow for not only basic nursing education, but also graduate nursing education also. In the middle is one of our immediate past presidents, Dr. Karen Daly, with President Clinton in 2000 at the signing of Needle Stick Safety and Prevention Act. And I have no idea who that handsome guy is there with George Bush, but that was President Bush giving me Nurse of the Year award for the work that I did with the victims of 9/11. But when we turn into our advocacy efforts, and when there's any piece of legislation that affects health and healthcare, and ANA may be asked to weigh in on that, we use these 4 guiding principles to ensure that that this is included in any piece of the legislation. So the first one is to ensure that there's universal access to a standard package of essential healthcare services that for all citizens and residents. The other one is to optimize primary, community-based, and preventive services while supporting a cost-effective use of innovation, technology-driven, acute hospital-based services. The third is obviously to ensure that quality is there as well, and to ensure a mechanism to stimulate the economical use of healthcare services. And then finally, to ensure that there's a sufficient supply of skilled workforce that is dedicated to providing the healthcare services that is needed as well. So when we talk about advocacy and nurses, we advocate all the time, and I know that ANAC nurses are quite the advocates as well. But advocacy, as you can see, is defined as the act or process of pleading for, supporting, or recommending a cause of action. And we believe at ANA that advocacy is a pillar of nursing. Nurses instinctively advocate for our patients all the time in our workplace and also in our communities. But for some reason, when it comes to political advocacy, we want to stand on the sideline, and that is not the time for us to do that. That is the time that we really need to pick up the mantle and encourage change. So some of the things that we have done over the past 19 months, our commitment to advocating on behalf of frontline nurses. We have sent letters regarding aid packages, state resources, PPE testing and supplies, staffing, and to the work of both the past and current administration and how to tackle the coronavirus. We have petitioned for nurses to add more nurses to the coronavirus task force. We sent joint letters to the administration requesting emergency funding and suggesting actions and strategies to combat COVID-19. We've issued call to actions, such as for APRNs to have, again, full practice authority and emergency waivers. The federal response to the pandemic, weighing in on some of the things that need to be done for that. Advocating for hazard pay for nurses who are on the front line, actually all the healthcare team that is on the front line. Calling, again, for nurses to be present when discussions are being held about the reopening of America. One of my favorite saying is that if you're not at the table, then you're on the menu. And I think it's vitally important that nurses be at the table who knows the community better than a nurse, right? So we need to be at the table when these discussions are being held so that we can ensure that things are done properly and that everyone's needs are being met as well. Now, I'm sure you probably have heard that there's a little thing happening now called a staffing shortage, and I shouldn't say little thing because it's a major thing. Part of it we know is because of the nurses being burnt out, having both mental and physical exhaustion, extreme fatigue. And on September 1st of this year, I wrote a 6-page letter to Secretary Becerra, Secretary of the Health and Human Services, asking him to declare the nursing shortage a national crisis. Now, in my introduction, Jonah mentioned that I've been a nurse for more than 30 years, and yeah, we can add probably 15 more to that. And every year that I have been a nurse, there has been a shortage, but nothing to the extent that it is at this time. And it is very frightening because, as we know, without nurses, there is no health or health care. And the healthcare system is beginning to show signs of possibly imploding on itself. So in that letter, I outlined ideas that the Secretary could use, but I strongly encourage that we need to bring government, public, and private entities together to the table, and let's solve this issue once and for all. And I know that we are going to have short-term and long-term objectives for this, but this is the only way that we're going to really apply the attention that this needs, so that we can, we won't continue to have this shortage going on and on and on. So far, I've not heard from Secretary Becerra. His office did acknowledge the receipt of the letter, and then we were told, well, expect to get a response on October 6th. Because we're gathering some background information, double checking the data that you put in your letter and et cetera. And October 6th comes around and no response. Oh, expect something on October 13th. October 13th comes around, no response. Starting next week, I've already informed staff that we're going to start a series of op-eds to the New York Times, the Washington Post, USA Today, and any other newspaper that would take that up. But just giving the Secretary a little bit of a nudge that, this is things what nurses do, right? We find ways and we find solutions, but we definitely do need to bring all the parties to the table to begin to address this. So we're not going to give up on this. In the meantime, some of the things that I've been doing is, as recently as the last 2 weeks, has been hosting listening sessions, wanting to hear from nurses on the front line. What is it that is either keeping you at your position or that is making you want to leave? I know that we need to feel valued, and for some people, feeling valued takes on different things. For some, it's a pay increase. For others, it's just acknowledging that, that I am there. For others, it is maybe working shorter hours or making sure that when I am off, I'm not going to get that phone call from my supervisor asking me if I can come in and work another 8, 10, or 12-hour shift. So I'm gathering the information from those listening sessions so that when we do convene this meeting, we'll have some evidence from there as well. We've also have started a national nurse staffing task force. We have partnered with, for Partners of Nursing Staffing with ANA, the American Association of Critical Care Nurses, AONL, HICFA, and launching the National Nurse Task Force. And the purpose of this is to provide a forum for powerful dialogue on the national scale to address the critical issues related to the nursing staffing crisis. When nurses are looking and seeing that I can quit my job with this employer, sign up and become a traveler and make 5 to 10 times that amount, that's fine. I mean, there is always a need for travelers, but I think one of the things that they may be in a rude awakening for is that when the pandemic is over, then what's going to happen? The fine print on their contracts says we can end this at any time, so you need to have a plan A and a plan B, and that is certainly something to think about. So anyway, this is an ongoing dialogue. We hope we'll be able to get some solutions, very soon. And please continue, if you read or subscribe to the New York Times or the Washington Post, look for those op-eds, and I encourage you also to write in and have your voices heard also. Other things that we've been doing is, since our annual membership assembly meeting was virtual again this year, but we had a virtual Hill Day. This is a time when our nurses go up on our members go up on the Hill and they meet with their members of Congress, and they talk about, healthcare legislation that may be affecting their practice or their ability to practice. And we also have our nurses sign up for RN Actions, where they get emails about pieces of legislation that they need to send a email or a text to their congressman or their senator and asking them to support the pieces of legislation as well. I'm going to spend the next few minutes just talking about a new initiative that ANA has undertaken as well, and hopefully some of you have heard about it. If not, I'll be happy to talk with you a little bit more after the presentation. But obviously, with the death of George Floyd, we all saw and with what was going on as well, as we're seeing how COVID was affecting communities of color disproportionately, that shined the light on the huge disproportionate care that people of color are receiving. And even though a lot of entities have started work in DEI, or diversity, equity, and inclusion, sometimes they have looped these together. Sometimes People or organizations may think that just because I have one person of color on the committee or on our board, that checks the spot and we can move on, and that's not it at all. They're totally getting it wrong. So healthcare, like nursing, is facing a very hard reckoning in this area. And again, as a result of the COVID shining the light on that. I want to state here unequivocally that ANA is committed to tackling racism. Our code of ethics demand no less. And, as nurses, we accept people for who they are. And I think one of the problems with, as I said, trying to understand DEI is that when they think about it, they do not have a full definition of what DEI stands for. So I heard this nice little definition that you see here and have started including that in my talk. Diversity is where everyone is invited to the party. Inclusion means that everyone gets to contribute to the playlist, and equity means that everyone has the opportunity to dance. And again, just as I said, just checking the box because you have diversity doesn't quite cut the mustard. So as we know, racism is a longstanding public health crisis that impacts both the mental, spiritual, and physical health. And again, it was just exacerbated with COVID-19, particularly in communities of color. Some of the underlying factors that is driving this disproportionate burden of disease are the social determinants of health, meaning the social and economic factors that contribute to poor access to health care and poor health status, including high incidence of chronic diseases such as diabetes and hypertension. In May of last year, I had the pleasure of being up on the Hill and meeting with the members of the House Committee on Ways and Means and having a discussion with them about the disparate impact of COVID-19 on communities of color. I shared recommendations specifically related to COVID-19 and to address the longstanding issues of racial disparities, including the crisis of maternal health and basic access to health care, including mental health services. I'm proud to say also that during our 2020 membership assembly, the ANA Board of Directors and our membership assembly adopted a resolution on racial justice for communities of color. And it just reaffirms ANA's position against racism, discrimination, and healthcare disparities. And some of the things that it specifically points out is that we oppose and address all forms of racism and discrimination. We condemn brutality by law enforcement and all act of violence. We champion the code of ethics for nurses, which calls for us to recognize human dignity regardless of race, culture, creed, sexual orientation, ethnicity, gender, age, experience, or any other aspects of identity. And the list goes on and on. But and again, to read that, please go to nursingworld.org. But I'm so proud that our board and our membership assembly voted on this resolution because it gave us the opportunity to launch an even bigger campaign, and that one being that we continue to add value by understanding our critical role in addressing equity. And so equity, as we know, falls within the continuous range of ethical issues or dilemma that nurses must face. And all these things that you see here are some of the things, but understanding the distrust of the healthcare system, and also healthcare, access to healthcare for people of color, and how that may be difficult to obtain. But as nurses, we need to begin to tear down these walls of racism that exist. We need to use our voices to influence and educate others about systemic injustice, healthcare inequities, and health disparities. We need to educate ourselves and then use our trusted voice to influence and educate others about systemic injustice that that causes riots and protests and et cetera that we're seeing covered in the news, and have people to try to understand that these riots are occurring because people have been overlooked. They have not had their needs met, and they have reached the breaking point. We need to listen, and the key word there is actively listen, not just listen, but actively listen, and engage in dialogue with others. And of course, being aware of our own unconscious bias as well. Well, as a result of that, we, ANA, launched the National Commission to Address Racism in Nursing. And I'm proud to say that under my administration that we're able to collaborate with 3 other major nursing organizations to bring this about. We have partnered with the National Black Nurses Association, the National Coalition of Ethnic Minority Nurses Association, and the National Association of Hispanic Nurses. And this group will explore racism in nursing and create a national action plan to guide the diversity, equity, and inclusion efforts within the profession. We have developed a vision statement, a mission statement, and a definition of racism. And this is, we're calling this a nursing definition of racism. And we are very proud to say that Dr. G. Rumey Alexander from the University of North Carolina School of Nursing is serving as our scholar in residence as we begin to address this issue. But the whole idea is that we are looking at racism in nursing from 4 specific areas: nursing education, clinical practice, research, and advocacy. Now, let me go back to nursing education for just a second. Just like when a baby is born, we know that a baby is not born prejudiced, right? It's a learned thing. When we look at nursing education, we know that sometimes the way different cultures are portrayed in nursing textbooks are inaccurate. So the theme is that by hopefully creating a set of standards and practice guidelines that organizations like the National League of Nursing and AACN, when they go to accreditate a nursing program, they will say, we have adopted these guidelines from the National Commission to Address Racism. Show us how you have incorporated that into your curriculum. The idea is that hopefully then that will be able to drive change in the way nursing schools will discuss various in different cultures. One of the things when I've had talks with deans and directors of schools of nursing, I've asked them to, when you pull into your personal parking spot, and you get out of your car, first of all, I want you to, when you get out, since most of them are white, change your color and maybe even change your gender. And then when you walk through your halls of your building, and you walk past those rows of white women who have served as dean of that particular school, notice that. What's wrong there? If you're not seeing diversity or looking at your faculty, do you have people of color on your faculty? And if so, what is their rank? Are they there as an instructor? Are they there as an associate professor? Are they there as an assistant professor or full professor? Look at it from the perspective of your students. Does it have a welcoming atmosphere? If you were a student of color, do you see someone who looks like you that would say, welcome, we welcome you here? Or do you have the resources that those individuals may need as well? Thank you. Even providing resources that they may need, if you truly understand your students and where they come from. Now, I live in North Carolina. I live in the Research Triangle area, which is very high technology-wise. But then 3 miles away, not 3 miles, sorry, 3 hours away, there's areas of the state where they're still using dial-up in order to get to the internet, okay? So if I'm a nursing student, even going to the local community college, and I have talked with students who have said, in order for me to be able to keep up, I have to get in my car and drive to the local McDonald's or supermarket, to get Wi-Fi there. So if I'm a dean of a school of nursing, just giving that student a hotspot that will enable them to, be able to keep up with their lessons. Those are some of the things that we can do to let students know that you are welcome here. And what do you do to actively recruit students of color to let them know that they are welcomed as well? So we're hoping that by doing that, we'll see a change in curriculum. We'll see a change also in the NCLEX exam. For well, looking across the audience, you guys look fairly young, so I'm assuming that probably when you wrote the NCLEX, you sat before a computer and you hope and prayed that, oh, once I got to 70 questions, will it shut down? Well, I'm from the old school where you had to drive to the state capitol, was issued was issued 2 number 2 pencils, and you had to fill in these little bullet things, and you tested for 2 days. And also, if you had to go to the bathroom, you know, a proctor had to go there with you as well, just to ensure that. So I say all that to say that hopefully it will, the way the NCLEX is now and the way they evaluate your proficiency on all the things that you studied is they give you scenarios, okay? And so the scenario may be inaccurately portrayed of someone who is a person of color. But because you were educated that this is the way people of color, you know, maybe deal with pain or, you know, or view health and et cetera, you know, you're getting, it's just reinforcing, you know, the inaccuracy that you were taught. So hopefully that would be drivers of change for the NCLEX exam as well. Now, clinical practice, again, talking with chief nursing officers, you know, asking them, look at your policies, you know, what are serving as roadblocks for people of color to perhaps advance into positions. Identify, you know, people who you could take under your wings and mentor and eventually move them into leadership positions. One, it helps to ensure that the individual is going to remain faithful to the organization, because if I see the organization is going to invest in me, more than likely I'm going to stay there, as opposed to if I've tried to apply for maybe an assistant nurse manager position or a nurse manager position, but I'm constantly told, well, you know, you just don't have enough, or you need this degree or that degree, but yet the person who got the job had the exact same degree, but was told, well, if you work on and get your bachelor's within, you know, a year or two, then, you know, but I was not afforded that same opportunity. So again, hopefully then the Joint Commission, when they come in to evaluate that facility and say, we've adopted these guidelines that the National Commission has put forth, show us how you have incorporated that into your policies and protocols and et cetera. So that's what's going to be the drivers of change. Same thing with research and same thing with advocacy as well. So we're hoping that we will be able to have the first initial report of this commission on May 7th. May 7th is a specific date because it is the birth date of Mary Seacole. Some of you may or may not know who Mary Seacole was, but she was right there at the Crimean War with Florence as well, even though Florence did not want her. She paid her own way. She also, she's a woman of color, and also you know, took care of the sick and injured as well. So that's why we have chosen that date. But some of the things that the commission has done is we've engaged in, again, more listening sessions as well. We have also, as a result of that, it's amazing some of the stories that people have, you know, stories that people have held in for 30 plus years. You know, when you hear black nursing professors say that I'm standing in a patient's room with my white student, the patient is talking to the student like I'm not even there, asking the student the question, and the student turns around and asks me. You know, that's, you know, there's something wrong there. Or we find that obviously workplace issues as well are some of the things that will be addressed there. So some of the things that we've been doing with these listening sessions is that they have been very cathartic, but we've also gained a lot of information as people have told their stories. And as a result of that, we're having some toolkits and other things that will be put forth as well. And some upcoming events that you may be interested in. On November 17th, we're having the Navigate Nursing webinar, which features one of our board members, Marcus Henderson, and Dr. David Williams from the Future of Nursing co-chair. And Dr. Williams is the subject matter expert on racism in the public health. The first quarter of 2022, we hope to have a quick video series about anti-racist behavior. And the first and third quarter, we'll be hosting ECHO educational series as well. And as I said, in May, we hope to have the first of the Commission's report put forth. And in the third quarter, we'll have a virtual forum on racism in nursing as well as we begin to move this agenda forward. But I'm hoping that that will perhaps be my part of my legacy as president when I step down in about 13 months. An ongoing priority of my presidency also has been to increase the diversity in nursing, not only in nursing but in practice as well, to better reflect our nation's population. I think it is critical that everyone feels welcome into nursing and also into the ANA in general, and that they are supported throughout their whole career as a result of that. So our aim is for a nursing workforce to be equally representative and diverse of the population that we serve. And how are we going to go about doing this? Well, before COVID came along, I was in consultations with the Boys and Girls Homes, Boys and Girls Clubs of America, asking them to, when they bring in, like an engineer or a scientist or a doctor to talk to young boys and girls about, those careers, that they bring in a nurse as well, and particularly a nurse of color and maybe a male to talk about careers in nursing. Because we take the exact same STEM courses that engineer is going to be, or that doctor, or that pharmacist. We do everything else that that they would do. But it's important that they see that nursing may be another career path for them. Another organization that I belong to, we have adopted a third grade school in Durham. And as often as I can, I go there because I want those boys and girls, again, to see that if this 6'6" black guy can be a nurse, then perhaps I can as well. So we need to plant that seed early for people to consider careers in nursing. We also need to start leadership academies, again, mentoring young boys and girls also to consider a career. And of course, as I've already talked about, we need to challenge what is going on in the textbooks and make sure that it is equally or is properly representative of a diverse culture. So leaders must come together at the local, state, and national level to commit to sustainable efforts to address racism and discrimination, police brutality, and basic human rights. And we must hold ourselves and our leaders accountable to committing to reforms for action. And as Dr. Martin Luther King said, the arc of the moral universe is long, but it bends towards justice. And I assure you that I take very seriously to be the leader of ANA at this time to uphold that particular principle. So, thank you. So given that we are winding down on the second year of the nurse, it's important that we still continue to work together as a state and national level. We still have a lot of things that we need to do. Our advocacy can influence our ability to empower nurses, to promote teamwork and level the playing field, to improve the workplace, to enhance the patient experience, and also to build healthy communities as well. So, and I invite you to join us on that path as we do that. And I think we have a few minutes left. If someone, I'll open up for questions if anyone has any. Thank you.
Good morning.
Good morning.
Thank you for addressing us. My name is Candace Elam, and I'm a family nurse practitioner practicing in the Bronx. I have 3 questions. I hope you have time.
Yes.
Okay.
Well, you got 11 minutes and 27 seconds.
Okay, all right, let's start. Bismillah. Okay. LPNs, LVNs, and RNs are limited in the types of jobs that they get recruited for. Mm-hmm. So I'd like to know how the ANA is eliminating barriers to employment for nurses who do not have bachelor's degrees, especially in light of this growing nursing shortage. My next question.
Well, can I answer that one and then we can
sure.
go? Thank you. Let's just take one question at a time. We're doing quite a lot. What we are seeing is that as the shortage is happening, particularly in acute care, most LPNs have been please forgive this term, but relegated more or less to work in long-term care. But what we are seeing now is that hospitals are now bringing LPNs back to help with, and probably going back to an old model of nursing, team nursing, where the LPN, mostly provided medications and things like that. But then since then, their scope of practice has expanded. So they are that way. But we are having talks with the National Council of State Boards of Nursing. They're the ones who, because of scope of practice issues and et cetera, they're the ones who, who controls that. But also encouraging more schools of nursing to, to, if they are able to, offer more or admit more students. Of course, there's a faculty shortage. There's money, that's involved, there's clinical space and things like that, but most of those are controlled by the State Board of Nursing, which says that, you can only, each program can only admit so many students based on where they may be able to practice. But we are certainly working at the federal level to try to get more funding towards nursing education, and also that would not only for basic nursing education, but for faculty as well. And so hopefully it's not going to be the immediate answer, but at least down the pike, we hope that we'll be able to fulfill those needs.
Thank you. My second question, in discussing the agency nurses, and you had mentioned that agency nurses may be in for a rude awakening when these contracts dry up for them. But I'd like to know what about the employers and the disloyalty that they show to staff nurses when they are paying agency nurses two-thirds more than what they're paying staff nurses? They're not doing a whole lot to give staff nurses a reason to stay. And how is the ANA communicating this to those employers?
We are having those conversations and have been telling them that, yes. Well, let me put it this way. I speak with, there's about 40 nurses around the country that I speak with on a weekly basis, on a rotating weekly basis. But I started this before COVID because I wanted to be able to have a pulse of what's going on at the grassroots level. And when I began to hear that, nurses were, the travel nurses were, had increased and et cetera, we began to tell the chief nursing officers, you need to do something. You need to be able to reward those nurses who are remaining loyal to you. The days of the cup of coffee, the bagel, the donut, and all that, those are over. And they realize that. So when I spoke about valuing nurses and how that may be different, that's important for them to come out of the C-suite, go down to where those nurses are, talk to them, have town halls, be transparent, and say, we're trying to, get more nurses. Travelers are here, but they are here temporarily because, again, without them, we're not going to be able to, maintain a unit, but we'll try to get them out as soon as we can, that type of things. I think being transparent and asking for their suggestions. Do you have any suggestions? And it could be, one of the things I know that's been batted around is, everyone's working 12-hour shifts now. And we know 12 hours turns into 13 or 14 hours. Maybe we're going back to looking at 8-hour shifts or, to help alleviate the fatigue that nurses are experiencing. But we are challenging the CNOs to be transparent, to make rounds, and while you're at it, grab that chief financial officer because he or she is the one who controls the purse strings. Even though the CNO may be advocating for more staff, that CFO may just see that a nurse is a nurse is a nurse, and they don't understand that a nurse who works in the emergency room is not the same as a nurse who works in labor and delivery. And you can't just put a warm body there. I mean, you can, but you're trudging on very treacherous ground when you do that. So I think the chief financial officer needs to also make rounds and get a better picture of what it actually looks like and how healthcare system work, and not just look at the the bottom line, which is a profit for the institution if they are for profit. So
Thank you. My final question
Yes.
is about nursing education. In some nurse practitioner programs, nurse practitioner students have to find their own clinical placements. In fact, some nurse practitioner students are charged for, by a preceptor for their clinical placement, somewhere in the neighborhood of $2,000 for a particular semester or several $100s an hour. This is not something that medical students face. This is not something that PA students face. So how is the ANA and the ANCC going to facilitate high-quality clinical placements for NP students that don't come out of these students' pockets?
Well, first of all, that's a great question. And you guys really are activists. Let me state, that's a great question, but also recognize that when it comes to ANCC and certification and et cetera, there's a perceived firewall, okay, that I can't cross over, because of the credentialing issues and certification of, ANCC being ISO certified, okay, so we can't, we can go up to the wall, but we can't go over the wall. And part of that is like a question that you have addressed. I can say, though, that we have had those conversations. And one of the things, it's proprietary. Something is going to come down the pike, let me say, but I can't put that out right now because it's proprietary.
A matching program would be nice.
Yeah, it would be, wouldn't it?
It would be, yeah. Thank you very much.
Thank you. Yes.
Thank you very much for your presentation. Our members, as you can see, are advocates. Our members are also nurse educators, clinical frontline folks, clinical leaders, nurse scientists and researchers, and also policy and advocacy folks. And so I was particularly struck by the way that the campaign on racism in healthcare, racism in nursing is organized. And I really want to applaud you and the commission on the action steps and the outcomes that will come out of this. That's the first time I've heard that. And so I think I'm going to put us forward as a way to promote that, because we all hear about these reports that are then put out on a shelf, but what do they really achieve? And to hear how that's going to impact certifications and other things that will make people do action is really important. So thank you on that.
Thank you. This is one of those once-in-a-lifetime opportunities, and we need to seize this moment or it's lost. Yeah. And I think there are 36 organizations that are on the commission. And we also have subject matter experts, but there are things that I would invite you to do as well. As before the report is going to be released to the public, we will need some reviewers to make sure that we, covered, pretty much everything, and would welcome the input from some of you if you're interested in doing that. Please let me know, and also just. Again, all of our organizational affiliates are, they are there at the table as well. So send word, through your representative that, is this covered or that covered, type thing. So we definitely welcome all input.
Yeah, actually, one of our members is on the commission, I believe,
Yes.
Sheldon Fields, Dr. Fields.
Right.
Yeah. And so now I have a question. There is a nurse practitioner running for state office in Pennsylvania, Tariq Khan, who is a friend and colleague of some of us in the room. And I'm wondering, how does the ANA support nurses as they're running for office?
We support them in a number of ways. Obviously, our PAC, we make a contribution to their campaign as well, but then also work with the State Nurses Association as well for anything that they may do, and getting the word out, just like you have said. And we have always encouraged nurses to consider running for political office. I think right now in Congress, there's 3 nurses who are congressmen and none who are within the Senate. But we definitely need to have our presence felt because, obviously I know the Senate is, I think there's about 6 doctors in the U.S. Senate. We definitely need to find our voice. So, and yes, Tariq was president of the Pennsylvania Nurses Association, and then dropped out to run. We're supporting him in every way that we can. So thank you for making that announcement, though. So again, it's just encouraging folks to be able to do that.
Local offices are equally
Yes.
important. That means
Absolutely.
school boards, city
Yeah.
council.
Or even just going to county government meetings and whatever, and speaking up and saying, I am a nurse and I'm a registered voter. That gets that has a lot of weight to it than what you really would think. So have your voices heard and talk about healthcare or lack of healthcare in your community, that you may need a Walmart or a Walgreens or CVS or something, so that people within the community will be able to have access, and not it's not to shoot down the Dollar General or the Dollar Trees, but some of the foods and things that they serve or sell are so high in sodium and et cetera, it's not really healthy. But so when you're trying to do nutrition education for your client, and you find out that they don't have a grocery store, they can only go to the Dollar General and and get what's there. It's like a dog chasing his tail, sort of.
Thank you.
Thank you.
Do you have time for one more question?
Yes, I do.
Thank you so much. My name's Carol Dawson-Rose. I'm from the West Coast, and I used to be the ANAC president until yesterday. So I'm the immediate past president.
Is that why you have that smile on your face there? Yes.
I loved everything that you said. It's very inspiring, and it's very inspiring to hear these from our lead nursing organization in the country. And I'm very curious to hear if you have any thoughts about the state boards of nursing and how there might be change there. And I hear that you have relationships with, and we all work at this, and I'm an educator. And it's very frustrating, and I mean, it's probably a common experience in terms of placements, in terms of the number of people that can come in as students, and I know it's a separate organization, and it's like states' rights for nurses. So I just wondered if you had any themes about how do we change that?
I think you are right in that it is a state's right, so it would have to be upon the nurses within the individual states to, and also usually most state boards of nursing, they are an arm of the state government, because their job is to protect the the health and welfare of the public as well. So they take their charge, if you will, from the state legislators, but it doesn't mean that those some of those things perhaps can't be changed if the right information is put forth. But then of course you don't want to. Well, like in my state, I'm very proud to say that our State Board of Nursing is the only one where nurses actually select their board members. We're very, very proud of that. And there's one, I think there's one elected public individual or selected public individual who's put on there by the legislature. But other than that, all the nurses in North Carolina have a say in who represents them on the state board, which is great. But then the opposite of that is, okay, if you go and complain, then you may get someone who's there as a political favor and still not understand who we are, what we do, and what we have to accomplish. So 6 of one, half dozen the other. But yeah, I do believe though that the state board perhaps, and their friends and colleagues. So, and I'm not saying anything I wouldn't say to their face, but I think their range, if you will, is pretty strong, and maybe some discussions do need to be had. So, well, thank you all for the opportunity to present with you, and have a great rest of the meeting.